I'm Dr. Julie Tennille, Assistant Professor of Social Work at Westchester University. I'm working with the Temple Collaborative on Community Inclusion to develop a training toolkit to help providers working with persons with mental health conditions to get more comfortable having conversations about sexuality and intimacy. Why? Well, I'm going to tell you something that you probably already know to be true. Sex and intimacy are really important things in our lives. You don't have to read my or other person's research to know that this is the truth. Over 40 years ago, the World Health Organization proclaimed sexuality to be integral to overall health and well-being. So turn on the TV, read a book, go to the movies, or stand in line at the grocery store, and you'll see evidence all around you. As adults, most of us want to date or be in an intimate relationship with someone. And if we're in long-standing relationships, we continually reflect on the quality of sexuality and intimacy. It's just what we do. So here's what I want you to listen really closely to. When I say that sex and intimacy are important in our lives, I'm including persons with mental health conditions. All too often, providers assume that clients that they work with are asexual, or if they are sexual, they assume that they're heterosexual. Sometimes providers want to protect their clients with mental health conditions from enduring the stress of dating. But hear what Pat Deegan has to say on that topic. She says that there's dignity in risk and a right to failure. And no one prevented me from going on a date that didn't lead to a relationship. So is it too personal to talk with persons about this topic? Here's the thing. We're often the closest people to the persons we serve, and having the skills to help someone think through their goals for intimacy that may relate to recovery is really important. Of course, keeping in mind professional boundaries and understanding that not everyone will want to talk about this topic is necessary. But try to remember that coping with a mental health condition can really complicate sexual expression. Side effects of medicine to manage mental health conditions can make it difficult, if not impossible, to perform sexually. And oftentimes, in the absence of consultation, people stop important medicines or even forego the use of a condom because a sexual response can be fragile as a result of these powerful medicines. My colleague Eric Wright loves to say that there are 3 things that people want and need related to their recovery: a house, a job, and a date. So stay tuned for our toolkit on intimacy and sexuality.